In today's GP Core content, we're talking about Styes. It's brought to you by GP Core content. And if you like this, please consider buying the book. It's called KFP Questions and Answers in Ophthalmology, and it's available on iBooks. So in the case today, we have a patient, Karen. She's had 2 weeks of a foreign body sensation. She's noticed 2 lesions in her eye, one inside her bottom eyelid and one outside her upper eyelid. This is associated with tearing, irritation and mild pain. And she's got a history of seborrheic dermatitis and also seborrheic blepharitis. Her other lesion looks like this. So in terms of the background of Styes or Hordoleums, they're essentially staph abscesses of the hair follicle, and they can be internal or external. The usual key features of history of Hordoleums include painful mass on the eyelid. It can be red, swollen, have a discharge, have crusting. Patients can complain of foreign body sensations or tearing, and also possibly light sensitivity. The key features of examination that you might see will include basically what it looks like in the pictures: a painful mass on the eyelid. It's red, swollen, you might see a discharge or crusting, and you may or may not see multiple lesions. The causes of Styes or Hordoleums, they can occur spontaneously, but they can also be increased in rate by things like chalazion, blepharitis, eczema, and poor personal hygiene. The differentials of Hordoleums or Styes include things like chalazion. If they're large enough, they can be confused with orbital cellulitis or tumours. You can have cysts, so a couple of different types of cysts: sebaceous cysts, mole or Zeiss cysts, papillomas or pyogenic granulomas. Investigations in Stye include basically things like swabbing it and sending it off for microscopy and culture and sensitivity. And if you're unsure or need to differentiate it from a tumour, you can consider biopsy, obviously. The management of Styes, you've got a range of options. They include doing your hot compresses to try and get it to come to a point and spontaneously resolve. If it's near a lash, you can pull the lashes out and do lash epilation. You can incise and drain it. You can apply basic concepts of lid hygiene like you would in chalazion or blepharitis. And if you need to, you can use topical, say, clawstick ointment or oral antibiotics as well if you need to cover that. The complications of Styes, basically, if they continue to evolve, they can progress into being like either a preseptal or orbital cellulitis, or I guess if you get pus in your eye, that can, potentially lead to bacterial conjunctivitis or keratitis. The references for today include the usual suspects, and another reminder about the book. So it's got all the questions of ophthalmology and KFP. The idea is to cover every single possible question that could be asked in this particular topic and to find the answer keys for them all. And it's available on iBooks.